Hello, myself Rama Bandari. Today I'm going to do oral presentation. First of all, I will talk about ADUE assessment for patient experiencing chronic obstructive pulmonary disease exacerbation. In airway, David airway was patent and self-maintained, and his and while doing auscultation, we heard wheezing or crackle sign of COPD. And then for airway, we have to check airway obstruction, and we need to assess the ability to speak. And in breathing, we need to assess for respiratory rate. Here, David's respiratory rate is 30 breath per minute, and his oxygen saturation is 78% in room air. Nurse should monitor oxygen saturation and administer oxygen. And here David has diminished breath sound, and wheezing and crackle sound were noted, and David uses accessory muscle for breathing. In circulation, his blood pressure was like 158 by 95, and his heart rate was 134 beats per minute. We need to assess for fluid overload and monitor for hypertension and tachycardia. And his capillary refill time was 4 seconds, and patient was pale and cool. And in disability, his Glasgow Coma scale was 4, and he was mild impairment in verbal response, and in COPD may impair cognitive function due to hypoxia and hypercapnia. In exposure, David is febrile with intact skin and has IV cannula on his right hand. His abdomen is soft and non-tender with normal bowel sound. In diagnostic result, we can do chest x-ray so that we can know which shows about pneumonia and possible pneumothorax. In blood test, it shows the report of anemia and shows the sign of infection. And we can do arterial blood gas, and electrocardiogram are essential to check oxygen level and monitor electrolyte balances. To treat, we need to do oxygen administration and maintain target oxygen saturation and prevent hypoxemia. Bronchodilator and corticosteroids can be used to reduce the inflammation and bronchospasm, and we need to monitor for balance to prevent dehydration, fluid balance. For high priority nursing intervention for managing the exacerbation of chronic obstructive pulmonary disease. First of all, continuous oxygen therapy. Oxygen levels should be maintained between 88 to 92%, especially for COPD patient, and continuous pulse oximetry is used to monitor oxygen saturation. Good oxygen management prevent complications like hypoxemia and hypercapnia. And another one is COVID-19 management. We can isolate the patient in negative pressure room to prevent infection spread, and we need to wear PPE, and we need to wash our hand frequently, especially before and after the procedure. For COPD patient with COVID-19, we should maintain SpO2 level and monitor closely for symptom and respiratory failure and other complication. Continuous cardiac monitoring. COPD patients are at risk of arrhythmias and ischemia due to reduced oxygen level. So continuous monitoring can help detect early sign of cardiac issues and right-sided heart strain. So in case of the emergency, or if something happens suddenly, then we can call rapid response team immediately. So that we should use pulse oximeter all the time for cardiac patient. Administer azithromycin. Azithromycin help prevent bacterial infection and exacerbation in COPD patient. The common side effect includes nausea, diarrhea, and rashes, which should be monitored closely. And patients should complete the full course of antibiotic to prevent recurrence of infection. If they feel better, then also they should complete all the doses. Otherwise, they will not get recovered, and they might get that infection again. Nursing responsibilities related to administration of following medication: oxygen therapy. Maintain oxygen saturation between 88 to 92%. We need to maintain oxygen level 88 to 92% for COPD patient, and monitor for hypoxemia, oxygen toxicity, and respiratory distress. And we need to check arterial blood gas level to prevent oxygen toxicity. Salbutamol or Ventolin. We need to administer salbutamol through nebulizer or inhaler for bronchospasm. And we need to monitor for breathing difficulty, bronchospasm, and side effects like tachycardia, tremors, and palpitation. And ipratonium or Atrovent. It is often used with salbutamol to treat with bronchoconstriction. We need to monitor for increased heart rate, dry mouth, headache, and urinary retention. Prednisolone. Prednisolone is another medicine which can be administered with food to reduce stomach discomfort. And after giving this, we need to monitor for side effects like hyperglycemia, hypertension, and fluid retention, and infection due to immune suppression. And another one is erythromycin or Zithromax. After giving this, we need to monitor for allergy, liver function, and side effects like nausea and vomiting. We need to make sure that patient complete all the courses to avoid reoccurrence of infection. It's same like even if they feel better, then also they couldn't stop that medicine. They should complete all the doses. Nirmatrelvir and Ritonavir. It's a medicine which is especially prescribed for COVID-19 patient, and we need to monitor liver function and GI side effect like nausea, diarrhea, altered taste, and headache. A diagnostic procedure commonly used to diagnose COPD and specific nursing responsibilities related to that procedure. It's spirometry. Spirometry helps to do lung function test, and it measures volume and flow of the air, and it is helpful to diagnosis of COPD, and it helps to evaluate airflow and blockage. It can help to perform. It can be done by spirometer, and alternative diagnosis impacted by a correctly performed spirometry. Nursing responsibilities. We need to make sure that spirometer is functioning correctly, and also make sure that patient is comfortable and relaxed, and he is in comfortable position. And we need to provide education on the purpose and process of the test, and we need to monitor for breathing difficulty, and we need to ensure proper execution of the test, inhaling deeply and exhaling forcefully, and observe for dyspnea like shortness of breath and dizziness. And we need to monitor vital signs before and after the test. We need to provide patient with the rest before discharge and assist in next treatment steps. Thank you.